probably all are aware, UNICRI's technical cooperation, training, capacity building, and training programs or activities in the field of crime prevention, criminal justice, and counter-terrorism are always based on our findings of our action-oriented research and a thorough assessment of needs and requirements to address threats and challenges. This also includes, of course, our work to support member states on reducing reoffending through rehabilitation and reintegration. Focusing in particular on high-risk groups and violent extremist offenders, UNICRI has the last 10 years been supporting several countries in the design and development of comprehensive rehabilitation and reintegration programs, in particular focusing on development of risk assessment tools and related training, tailored training programs and activities. For example, a project in Mali, Indonesia, and other countries around the world has developed a risk assessment tool to determine levels of radicalization leading to violence and train prison staff on the use of such tools. In parallel, UNICRI is also undertaking assessment within our research programs to better understand the challenges and opportunities for the establishment of sustainable rehabilitation and reintegration programs. I think in general, and we already heard it many times, the challenges that we observed included overcrowding, very few, if any, rehabilitation and reintegration activities in place, limited education and training curricula, high number of pre-trial detentions, absence of an advanced risk assessment procedures, and many prisoners incarcerated far away from their families, just to mention a few challenges. Using the lessons learned and the empirical results from these programs, UNICRI are now expanding our programs to new countries, in particularly in close cooperation with the UN missions and to other areas of work. This includes, for example, also a partnership project with UNIFE, as already mentioned this morning, to jointly work on a research to identify the key elements that are common or generic and should be reflected in rehabilitation and reintegration training programs, in particular to improve the training of prison staff. The final goal is to develop and create a guideline on developing a training curriculum of prison staff training. Within this context, and this is the last example, within this context, UNICRI applying its highly specialized and advanced expertise on the use of artificial intelligence and related technologies through our Artificial Intelligence Center in Hague. We are now launching a new research study to assess how artificial intelligence and related technologies can be introduced into the rehabilitation programming activities within the prison setting. As you probably are aware, artificial intelligence is currently mainly used in the prison setting as a tool to reinforce the security, but a few countries have started to explore how the use of artificial intelligence could be used in their rehabilitation programs to reduce reoffending. As such, the first part of this research will include an assessment of the current trends and usage of artificial intelligence and related technologies in the rehabilitation programming activity in the prison setting, and try to identify best practices, lessons learned on how to use them in a responsible and human rights compliant manner. The second part of this process will be to pilot test action plans, training programs for introducing artificial intelligence and other related technologies in the rehabilitation programming activity in prison setting, tailored, of course, to their specific needs, priorities, and resources. I think they expect that a tool as virtual reality could complement or be added to a rehabilitation program to improve its positive impact. As we all know, the transition from the prison environment back to the outside world is an extremely difficult experience for those who have been incarcerated for many years. A simulated experience of the real world could offer some degree of ease ahead of integration into the society by exposing, for example, inmates to a realistic environment or situation by using virtual reality. The integration of inmates back into society can be facilitated, for example, by supporting them to practice their skills to cope with stress, anxiety, or manage aggression. Of course, as I already emphasized, artificial intelligence and technologies should be a complement to existing rehabilitation programs. Face-to-face contact and human-centered rehabilitation, of course, must remain a major part of the core values. We will, of course, be happy to invite you all to be part of the research process, and I look forward, perhaps in one of the next sessions, to share the findings and conclusion of this research. I thank you all. Thanks very much, Mr. Chair.